Hello, global youth. We are about to go live with this session where we look at coronavirus with a systemic and contextualized lens. My name is Vanessa. I am the chief trainer at AMP Global Youth and also Global Scholar, and we are going to get started in about 10 seconds. Let's give it. Let's see if anybody is ready to go. Hey Amber, great to see you online. We're just giving it a couple more seconds to see who else will be joining us. Amber has been doing a fantastic job today, by the way, everyone. Amber is a wonderful member of our AMP Global Youth Network. She's been doing some brilliant work behind the scenes. And earlier on today, she hosted a session with Greg Howard, who is a specialist in studying viruses and epidemics. And that was a really, really interesting session. So hopefully you have time at some point, either today or over the course of the next few days or whenever you're ready, really, to have a look and to hear what Greg had to say about coronavirus. Hey Dylan, great to see you. How are you doing? I hope you're well in New York. I hope you're keeping safe. Obviously, I am reporting live from London, UK, where we are officially in lockdown. And I know that New York is in a very similar situation, I'm sure, worse as I read on the news. So sending out lots of love, lots of solidarity to you, Dylan. I hope you're safe. I hope you're well. I hope your family are well. And let's pray for this global crisis to be over as soon as possible. Even though the session today is going to be, so I think we can get started. The session is going to be looking at how to systemically contextualize coronavirus and how to think about it in a way where we can actually understand the nature of the problem in order to respond to it in our own individual and collective ways. And so this session isn't about adding to any existing stress or anxiety that you have. Obviously, there is plenty of that going around, and I really, really have so much empathy and compassion for that. I'm in a very similar situation. I've had a couple of cries in the last week where I'm like, the world is changing. And it is changing. It is changing. And it's really about interrogating our relationship with change and seeing, okay, change is the only constant, is the only thing that we can guarantee is happening and will continue to happen. How can we respond to that in a way where we can drive our energy and our resources towards social change? So, as I mentioned at the beginning of this live video or broadcast, I feel like a journalist. I'm not. I'm just the chief trainer at AMP Global Youth. At the beginning of this live broadcast, I introduced myself. So just really quickly for those of you who are joining, my name is Vanessa, and as I've mentioned a couple of times, I work at AMP Global Youth and Global Scholar, leading learning and design and delivery of learning in our summer program, Global Scholar, and also throughout the year, all year round as well at AMP Global Youth, which is our larger organisation and virtual network of young leaders changing and transforming the world. Great to see you, Mohammed. Thank you. I'm waving back to you. I'm sure you are reporting or rather you are dialing in from Morocco. Really, really good to see you. Mohammed is a long-time member of AMP Global Youth, and we really appreciate him and all of the work that he's done with us. Okay, so let's get started. Coronavirus, COVID-19. There's not much more I need to say, so I'm not going to say it. There's plenty that we already know about the virus and so much more that we don't know. What I will say is this, and this is for us to be realistic and for us to be able to really think about how can we conserve our strength and energy, because this is going to be a long journey for us. Reportedly, we are about 5% of the way into coronavirus on a global scale. What does that mean? We're about 5% in. It means that coronavirus is only just beginning to touch regions such as the Middle East, Latin America, and Africa. And so on a global scale, we're barely getting started. And it's going to be around for a little while. And so what is there to say? If we think about Ebola was a virus, a deadly virus that hit us in 2014. And just to really contextualize and to start building some kind of relative scale, if you like, in terms of the differences between different kind of epidemic and pandemic viruses that we've seen in global history. Ebola hit us in 2014. Ebola had a death rate of roughly about 30%, and a transmission rate. What I mean by transmission rate is where one person who is infected transfers it to another person, infects someone else. So Ebola had a transmission rate of about 1, which means that for every one person that caught Ebola, they infected one other person. Why? Because actually Ebola was a very kind of rapid and very intense disease that essentially killed people very quickly. So people who were infected by Ebola didn't actually have a lot of time to infect somebody else, or numerous people. But the death rate, as I mentioned, about 30%, transmission rate about 1, right? Corona has a death rate which is much lower, and statistics are still kind of coming in about what that is as we are learning more and more about this very new virus. But the death rate is much lower. However, what that means is, because it's much lower, people have more time to be able to infect more people, right? So it's not such a debilitating disease that it takes over someone's systems, vital systems, so quickly that they don't have time to infect other people. Actually, the transmission rate for coronavirus is about 3 people. So for every one person who is infected, that person will go on to infect another 3 people, right? That is actually higher, much higher than Ebola. And what that means is that there is such a higher likelihood of our health systems being overrun, which may feel like not that big a deal. Hello, Ahmed. Great to have you. Thank you for joining us. Which may feel like not that big a deal if you are a young person, as most of our AMP Global Youth Network is, if you don't have underlying or pre-existing health conditions. However, think of it like this. If you were to go out tomorrow, which I'm not recommending that you do, but if you were to go out tomorrow and something were to happen, for example, you were to get into a car accident, for example, or a member of your family was, they would need healthcare. And if our health systems are overrun and completely overwhelmed and overloaded, then that means that doctors and nurses and healthcare practitioners have to start making really, really tough, difficult decisions about who to save and who not to, right? So my sharing that is not to make this issue one that only matters because it's proximate to you, because it's close to home. No, we should have empathy and compassion for people regardless of whether it's a potential family member who is affected by this or not. However, it's just to show the gravity, the magnitude of this situation and the thinking behind the government policy decisions that are essentially trying to save our healthcare systems. And the phrase you would have heard is to flatten the curve, right? To try and make sure that our healthcare systems do not get overrun too quickly, too soon, but actually that we can incrementally treat this disease, coronavirus, in a way that our healthcare systems are able to manage, are able to handle. Just to give you some more numbers in terms of like the transmission rate, or like how quickly coronavirus can spread. So coronavirus, in terms of like cases, coronavirus we can see cases multiply by 8 times in just 1 week, right? 8 times we can see the cases multiply, right? In 2 weeks, the cases can multiply by 40 times. In 3 weeks, we can see that number increase to 300 times. So you can really see the exponential way in which this virus can spread. And in 4 weeks, this virus can multiply in terms of infected people and cases, can multiply by 1,000 times. Okay, I'll give you that again. Multiply by 8 times in 1 week, multiply by 40 times in 2 weeks, multiply by 300 times in 3 weeks, and multiply by 1,000 times in 4 weeks. At the moment, globally speaking, we have 40 countries that are currently in lockdown, which means that about 2 billion, over 2 billion people worldwide who are confined to their homes and who are not allowed to leave their homes for any non-essential reason. And so this is unprecedented. This is a crisis on a human and an environmental scale that we have not seen in a very long time. And it is really all hands on decks. And so lockdown, what is the function of a lockdown? The function of the lockdown is to disrupt transmission. So remember I said that coronavirus has a transmission rate of about 3 people. For every one person that is infected, that person is likely to go on and infect 3 other people. And let's be clear, this virus does not discriminate. Currently speaking, Boris Johnson, the Prime Minister of the UK, has tested positive for coronavirus. So this is not something that is like, it will never happen to me. It can, and there is a high likelihood that it will. What we need to try and do, as mentioned, is preserve our healthcare system's capacity to be able to deal with the almost inevitability of, I think it's about 80% of people who will eventually be infected by coronavirus. And so the function of lockdown is to disrupt transmission, right? Is to disrupt it. So people are not in public space, sharing space together, sharing all kinds of vapors and fluids and all of that. Lockdown is to disrupt that. And as mentioned, to really protect our healthcare systems from being overrun. So while that is happening, while lockdowns are in operation, it is important for us to think about how we can build community resilience and capacity to be able to deal with the up and coming and fast incoming demand for healthcare and treatment that this virus is going to bring, whether it's directly or indirectly, right? And so we need to be thinking about all of the different ways that we can build our communities to be able to deal with corona permanently, in a way that extends beyond just, kind of short-term planning. However, saying that, it's also really important to recognize that right now we can't really plan beyond anything more than 3 weeks because of the nature of this problem, which I'm going to talk about. The nature of this virus, which is at the moment quite chaotic, and I'm going to unpack that in a second. But what we need to be doing with our kind of community building and community capacity building is we need to be protecting our healthcare workers. Right now, our healthcare workers are on the front line and they are working hard, right? And we need to be protecting them, making sure that we are not individually, personally, stockpiling resources that they need, whether that's face masks, whether that's food, whether, whatever it is, making sure that they have everything that they need in order to be able to do the jobs that they're doing. And we also need to be able to be looking after them as well in our neighborhoods, in our communities, in our families, in our friendship groups and networks. Do you know someone who's a healthcare practitioner? How can you be in solidarity with them, right? So do they need their dog walking? Do they need their kids looking after? Again, this is very much something where you have to use your common sense. I'm not asking you to go around doing all of these things if you're not able to socially distance yourself at the same time. However, what can you do to support healthcare workers in your community? And how can you boost their morale? What are the messages you can send? What are the messages that you can stick up to let them know that we're thinking about them and that they are so treasured and that they are so valued? It's so important that we do this, that we protect our healthcare workers at all costs, because they are on the front line dealing with this crisis. But this is a community problem, and therefore we have to have a community solution. It is not just healthcare workers that are going to be the heroes of this story. It requires a team effort from all of us. And so the final thing that's really important to do is to look after yourself. You, yes, I'm talking to you. You. Whether you're listening to this and watching this in real time, or whether you're listening and watching in the future or in the past, whatever time zone that you're in, you need to be looking after yourself right now. And that means looking after your mental health, because we don't want you to be stressed and in a place of ongoing anxiety, because that actually interrupts our ability to be empathetic. It interrupts our ability to to problem solve as well. And right now we need all hands on deck. So we need you to be looking after yourself in a way where you are protecting you're obviously protecting your personal space. That's important. We need social distancing right now, but we also need you to be in the best place, headspace, mind space that you can be in order to be able to be part of the solution and not part of the problem. Right? And so, with all of that said, let's dive into really thinking about how to frame the nature of this problem, right? And we're going to be using a couple of systems thinking tools. Systems thinking is one of the modules that we teach at Global Scholar, our summer program. It's specifically in our AMP Action Lab. We run a module called Systems Thinking for Complex Problem Solving. It's one of the favourites for our Global Scholar alumni. Am I right? And so I'm just going to be sharing a couple of framings for you in order to think about how is this problem manifesting systemically? How can we think about the ways in which we need to respond that are aligned with the level and the nature of this problem, the complexity of this problem, which is coronavirus COVID-19. And so the first framing is called the Sinha framework. And there are 4 categories or 4 levels that I want you to think about: simple, complicated, complex, and chaotic, right? Hey, Karen, great to see you. Karen is our program director at Global Scholar and chief maker at AMP Global Youth. Thanks for joining. And also, hi, Cynthia. Great to see you too. Thank you for joining us. Cynthia is our Global Scholar alum from last summer. I bet you're really, really grateful that you got in doing Global Scholar last summer. And needless to say, we are going to be doing Global Scholar this summer one way or another. We will be doing it either in person or virtually. So don't worry. We guarantee that you will be able to access all of the learning and joy that comes from Global Scholar, which looks at international affairs, social action, and global citizenship for young leaders making a difference around the world. So before I get too distracted, so the four categories, the 4 levels. So we've got simple, we've got complicated, we've got complex, and we've got chaotic, right? So let's take a simple problem. Right? A simple problem. A simple problem is when we know what we know. We know what we know. And there is a very clear cause and effect. Very, very clear. This problem has been around for some time. There are already rules in place around this problem. So we know how to react in a way where we can rely on best practice. The best practice is already out there. It's very simple. We know exactly what we know. We know how to deal with it. There's best practice. And it's all quite clear. And the rules and the parameters are already in place. Then you've got a complicated problem, which is where we know what we don't know, right? So really hear the nuance there. We know what we don't know about the problem, which means that we also know what we know, right? And so with this, with a complicated problem, there are a range of different cause and effects. It's not just one cause equals one effect. There are a range of different cause and effects, which means that it's not simple, but it's not complex or chaotic, which I'll get into in a second. It's still complicated in a way where we are still able to make sense of patterns and trends, and we're still able to lean on good practice, right? However, with good practice, we need expertise and we need analysis. So often we will look for the experts who have, been working on the nature of the problem for some time, and they'll be able to analyze all of the data that's incoming around that complicated problem in order to draw some good practice, and we can try to come up with a solution. So that's a complicated problem. Then we start getting into the messiness. Which is we've got complex and we've got chaotic. So a complex problem is where actually we don't know what we don't know. We don't know what we don't know, right? And here we are only able to make sense of the data that's incoming in retrospect. So we're only able to know what the cause and effects are, what all of the different causes and effects are in retrospect, in hindsight, right? But there's too much going on for us to be able to, there's too much kind of things happening for us to be able to really draw any clear patterns or trends in terms of the ways in which the problem is manifesting. And so here there are no right answers when we're looking at how to solve a complex problem. There are just no right answers. And the best that we can do is we can experiment in ways that are safe to fail, right? We can just experiment and throw different kind of prototypes at the problem and see what sticks. And here we're using emergent practice. So we're having to adapt to the problem and the way it's manifesting as we go along, as it emerges, as we are able to learn more. And then we have chaotic. Chaos. Chaos goes like this. Or maybe it doesn't. It's kind of a paradox. But chaos goes like this. The cause and effect is unclear, right? It's unclear and it's confusing. It's really, really confusing. We basically don't have much clue about what's going on. There's just so much happening, right? And the response is to stem the bleeding, to stop the flow, right? That is the first thing that we want to do. We want to stem the bleeding. And then we want to try and establish some semblance of order in order to take the chaotic problem to a complex problem, where then we can start to really work with how to adaptively and emergently solve the problem. But when it's chaos, there's no real way to make sense of the problem, and everything we're doing is our practice is very novel. We're just throwing anything and everything we can at the problem to just see what sticks. It's very novel. There isn't a lot of like rhyme or reason in the way that there is with a simple problem or a complicated problem, or even to some extent a complex problem. So the goal is to stop the bleeding and to try and establish some kind of order that brings it from chaotic to complex. Why am I telling you this? Why is the systems framework important? It's important because we need to understand the level of thinking that we need to go in to solve the problem. You know, it's like Albert Einstein said, problems cannot be solved with the same level of thinking that created them, right? So we need to understand what is the level of complexity of the problem in order to be able to solve at that level. Right? So simple problems require simple solutions. Complex problems require complex solutions. And this is what we learn about in the AMP Action Lab module, Systems Thinking for Complex Problem Solving, right? So that's one framework that's really useful. And at the moment, with coronavirus, COVID-19, we are somewhere between chaotic and complex. We're somewhere in between those two. And right now, the government policy is trying to establish order in order to take the chaotic nature of COVID-19 from chaotic to complex. Does that make sense in terms of the thinking, the ways in which governments are thinking about this problem? It's about how can we take it from chaos to complex. And that means first, stopping the bleeding, stemming the flow in our healthcare systems, for example. That's where you'll see that response. And then really thinking about, oh my God, my fire alarms are going off. It's okay, I don't need to exit the building. It's definitely a false alarm. So we'll try and stop the bleeding, stem the flow on the front lines in our healthcare systems when we're talking about coronavirus. And then it's about establishing order, which we see happening with government policy, but through these lockdown measures, right? And so we're trying to get from chaotic to complex. That's one framework for you, the Sinha framework. There you go, have it. It's Sunday, and look, AMP Global Youth, we're just bringing you all the juice, bringing you all of the knowledge and all of the tools, just for you to have to go and make change in the world. So let's move on to the second framework. And this is a framework that was created by an organization called Movement Generation. You can check them out at movementgeneration.org. Movement Generation came up with this framework that I think is really, really useful. And I'll talk about why in a second. But essentially, the framework is where you have shocks, slides, and shifts, right? Shocks, slides, and shifts. So many S's in there, which my list is not very happy about. Shocks, slides, and shifts. So what is a shock? A shock is an acute moment of disruption. A very acute moment of disruption that is catastrophic, right? So, for example, that might be a natural disaster. It might be a market crash, for example, right? It happens overnight, right? A shock to the system. Hey, for people that are joining, young AMP Global Youth leaders, thank you so much for joining us, and we really, really appreciate you. We're just talking about different ways of understanding coronavirus COVID-19 in using different systems frameworks. And so a shock, an acute moment of disruption that happens like that, right? And as I mentioned, such as natural disasters or a market crash. Then you've got a slide, which is an incremental catastrophe, right? Hey, Gabby, lovely to see you. Which is an incremental catastrophe, right? What does that mean? It means a dynamic, a pattern or a trend that is building over time, but is just as catastrophic as a shock, right? Is no less catastrophic or disruptive as a shock, but rather the nature of it is not so sharp and acute, but rather it's more of a chronic nature. It happens over time, and it might be increasing or decreasing pattern trends in behavior. So, for example, it might be like sea levels rising. It might be rising unemployment. It might be the rising cost of food and energy, etc., etc., right? So we see how it slides. Yeah. So that's the distinction between a shock and a slide. And the reason why I'm sharing this framework with you is in order to think about how can we harness the energy, the potency of shocks, and how can we direct slides in service of shifting paradigms, shifting cultural ways of being, shifting systems when we're thinking about it at the structural level of like policy and legislation. How can we actually drive shocks and slides in service of shifting the status quo? And that's where you've got that final piece of shifts, right? We want to try and harness shocks and slides in order to move towards shifting in service of social justice, right? And so again, here we are. Coronavirus is a shock. There's no question. We didn't see it coming, right? This was not what 2020 was meant to be about. God, go back to New Year's, right? All of the memes, all of the hope and dreams, all of the resolutions. Sure, we didn't see it coming, and it happened overnight like that, right? Crept up on us. A shock to the system, you could say. And there's going to be a lot of before and after slides that are also going to characterize the nature of coronavirus in 2020 for humankind, right? So there's going to be things that happen that have been building and happening in order to lead to coronavirus outbreaking in such a shocking way. So, for example, over the last decade, we've seen cuts to the World Health Organization, right? That has been something that has incrementally been happening, right? With this underfunding of the World Health Organization, for example. That's a slide that has led to a shock, right? And it's really important to think about, okay, so how can we reverse that? How can we flip that? So that we're actually using shocks to slide and eventually shift in a direction of social justice, equity, inclusion, ultimately equality and peace and sustainability. All of the good things that AMP Global Youth is very, very committed to. And so there you have it. Those are two frameworks that I think are really, really useful in thinking about coronavirus COVID-19. At the moment, we're somewhere between chaotic and complexity, chaos and complexity. And it's really about how can we on an individual and collective community level bring chaos into a more kind of complexity based or like way of like manifesting. And how can we also start to think about COVID-19 as a shock to the system that is characterized by the slides coming before, during, and after? And how can we harness that energy? How can you harness the time that you have right now to think, to be with yourself, to be with your loved ones, to just reflect on the world? How can you harness that energy in a way that's going to drive social, systemic, environmental change that shifts the paradigm completely? The name for the model, in the model there, someone is asking, hi, I can't see what your actual name is, I'm sorry, but Yeeches123, the name of the model is just called Shock, Slides and Shifts. And I can definitely follow up with a link, but if you go to www.movementgeneration.org, there's more information there. If you put it into their search engine on the website, then you can find more information about that model. Just shocks, slides and shifts. And you can also read more about it in a book called Emergent Strategy by Adrienne Brown. You can follow Adrienne Brown on Instagram. I fully recommend it. Lots of beautiful systems thinking, tools, tricks, tips, practices. And Adrienne Brown, she's a goddess. She's just incredible. So shout out to you, Adrienne. But yeah, feel free to hit me up afterwards as well if you want more information on that. And thank you for your question. Cool. So that's the kind of problem identification piece of coronavirus COVID-19 done. We've got about half an hour. We've got so Mohammed, the name is Emergent Strategy. I've actually got it here. I can show you. I'm so proud because I've actually been reading. There you go. Emergent Strategy. I hope it's not like back to front for you, but you get it. You get the point. And there is Adrienne Brown's name. There you are. Fully recommend reading it. I'm reading it again for the second time, and it is just giving me life right now as we are at home, locked in.